I'm Janet Papadakos. I direct the Cancer Health Literacy Research Center at Princess Margaret, and I am an assistant professor in the Institute of Health Policy, Management and Evaluation at the University of Toronto. My research is focused on health services research, which is looking at ways to improve the healthcare system. And my research specifically is focused on the role of patient education, patient engagement, patient self-management, and health literacy in looking at ways to improve the system and improve care. With advances in medicine and people living longer, the healthcare system or the models of care have shifted from being acute, where most care is provided in the hospital, to being more chronic, and also shifting more to the outpatient setting, where the vast majority of healthcare is provided in the outpatient setting, where patients and family have a much bigger role to play in taking care of themselves in the context of care and treatment. And if we look at the cancer system specifically, the vast majority of cancer care is delivered in the outpatient setting. Although there has been this major shift from patients being surrounded by healthcare professionals, experts to take care of, to a situation where they're often on their own, the practice of medicine, the way we provide care has not changed. And so patients and family have reported not feeling prepared to take care of themselves. And there's a lot of evidence that shows that if they are prepared, given information, training, if they know what to expect, what to look out for, that they actually have better outcomes. In Canada, 60% of working age people have low health literacy. And low health literacy means that they'll have difficulty accessing, appraising, and using health information in order to make health decisions and take action for themselves and their family members. If we look at people who are over 65, that number jumps up to 88% of Canadians have low health literacy. This is very problematic. The literature shows that people with low health literacy do experience worse health outcomes. They have less satisfaction with the healthcare system. They present to the cancer care system with later stages of disease that are more difficult to treat, more costly to the healthcare system as well. And of course have greater morbidity and mortality for patients and family themselves. On the other side of that, the healthcare system is not health literate. So the healthcare system has not been built knowing who its potential users are. And this is part of the legacy of the acute care model that just has not shifted and evolved to accommodate patient and family involvement at the level it has to be now. And so our research lab, the Cancer Health Literacy Research Center, conducts research into these areas to try to think about how can we make healthcare, how can we engage cancer patients and their families to be more actively involved in their care and provide them with the information that they need in a way that they can use it. So my research program is centered on three main pillars. The first one is health literacy, which is really looking to develop interventions to mitigate the impacts of low health literacy. And I'll tell you a little bit more about that in a minute. It's also self-management, so looking at ways to engage patients and family in their care, and then also patient education, which is looking to build patient and family health knowledge. In terms of improving your self-management skills, there are some things you can do very tangibly. And we say the same things to healthcare providers to get them to engage patients as well. To number one, think about your questions that you need to ask ahead of your appointment, and write those questions down so that you can make sure you get them answered. We all know that healthcare appointments are short, usually 15 minutes, sometimes longer, but make sure you put your most important questions first. You want to make sure those ones get answered before the end of your appointment. I think something else is to come in trying to plan a mutual learning agenda with your physician or the nurse or whomever you're seeing. Say, there are 3 things I really want to ask you about today. What did you want to meet with me about today? And try to see if maybe they're the same 3 things, which is fantastic. You can make sure they get covered. But if the physician or the nurse has something different, then maybe you can say, do you think we'll have time to get to mine as well? And maybe you need to book a follow-up appointment or a follow-up phone call now that we have virtual appointments. Ask what things you need to look out for at home. When you are finished treatment or you're managing side effects, ask, what can I do about this? Actually use those words. If someone is speaking to you and they use medical jargon and you don't understand, don't be embarrassed. Why should we be expected to understand medical terminology? We're not physicians. Well, maybe you are, but even still, you may not be an oncologist. And if that's the case, ask for clarification. I'm not sure I know what that means. Could you spell that for me? Could you use that term in a sentence to help me understand what it is? I think those are some good tips for working well with your healthcare provider. And being a good self-manager, someone who can self-manage their health, is someone who asks questions and feels comfortable to do so and asks how they can get involved. We have a number of other classes that we have built with clinicians at Princess Margaret. So these are physicians, oncologists, nurses, physiotherapists, occupational therapists, speech-language pathologists, dietitians, radiation therapists, who come to us and with a problem that they may say, we can tell that we're having a really hard time expressing this or explaining this to patients in a way that's meaningful to them so that they can then take on the information they need so that they can enact the behaviors that will help them. And so we have produced a number of classes with clinical subject matter experts at Princess Margaret, and you can check those out at pmcancerclasses.ca. That is a website where you'll find a whole host of learning opportunities. Some of them are videos, some are e-learning classes about very specific topics. In the cancer context, there has been very little developed to help cancer caregivers take care of family members and themselves. And with this recognition, we have received funding from a number of different places, including the Princess Margaret Cancer Foundation, to build the PM Caregiver program. And it is, you can check it out. It's a free program. You do need to sign in to access it, but it's at pmcaregiver.ca. And within there are over 2,000 different resources to help caregivers with whatever their needs are. And so you think 2,000 resources, that must be very overwhelming. How do you get people to actually find what they need? It sounds almost intimidating to go into such a thing when you're already feeling overwhelmed. But you can, we spent a lot of time designing the website to be very inviting and to organize the information under layers so you're not overwhelmed with options, that there's just a few options to choose from at a time, kind of like a choose your own adventure where you can make your way through the site to find what you need. People have a difficult time trying to determine whether the information they find on the internet is good quality or if it's relevant or credible or if it's up to date. And those are good questions, and there's so much information out there and so much of it looks legitimate, and it's really difficult to know if it is. And that skill of knowing how to navigate and identify valid or reliable sources of information on the web is called digital health literacy. And digital health literacy, there's a number of courses available that people can take to learn how to do that, but certainly within the Patient and Family Library at Princess Margaret, our librarian is happy to sit with patients, family, visitors, anyone who comes into Princess Margaret to learn how to do that. And there's a few key tips she'll give you, which are things like assess whether or not the website is asking you for anything. If a website is ever asking you for money, asking you to input information, there's a good chance that it isn't a solid or reliable website if you're just looking for information. Another is to look at the source, look at the URL, the website. And if it ends with .edu, education, or .org, or .gov, those are indications that those are reliable organizations. There's also, you can usually on the About Us page, you can see the date that the material was last posted and also who posted the information, whether they're physicians or whether they're people with appropriate expertise. But if you're ever in doubt, you can also check out the Princess Margaret health information pages, which has a number of very good, vetted, credible websites on it to help you find information. And you can also check out Princess Margaret CancerAnswers.ca, which is a search engine that we developed at Princess Margaret to help patients find the information they need, and we index outside materials from reliable places.